It is really heartbreaking for people that have put their all into their careers, whether it's a federal worker or for us as nurses across this country, providers, because we are seeing firsthand just how the system is breaking down and how we are trying to hold it up on our backs. And there's only so much more strength that we have. We need people to come together now more than ever and support each other, support healthcare, and support being a decent human.
It's important to be part of a union because you have to have a voice.
Welcome to Union Talk. I'm Randi Weingarten.
Welcome to a special episode of Union Talk, where we are talking to healthcare workers who always are heroes, but particularly right now, they understand firsthand what's really going on in terms of this government shutdown and what is happening on the ground and what's happening to real people, which is the motivating factor for the Democrats in the Congress to basically say, no, you have to fix this, Donald Trump. You have to fix this, congressional Republicans. And they know them well enough to know if they don't try to stop Donald Trump right now, then this is not going to be fixed. So I am really, really, really honored to talk to Heather Brouth, who's a PACU nurse and president of the Bacchus Federation of Nurses in Connecticut, to Shannon Davenport, who is a mental health nurse and president of the Alaska Nurses Association, and to Catherine Henderson, surgical oncology nurse and a member of the Ohio Nurses Association. And they're going to kind of take us through this. Since there's so much misinformation, I wanted to go to the nurses who really understand what's going on. So let me just say, the AFT's position is clearly no one wants a shutdown. The American people are the ones who suffer when government shuts down, and the crisis was and still is avoidable. But what essentially happened was that in the bill that the Republicans passed, the last time they actually took a vote, the bill they passed in July, they ended up in taking away a bunch of things. They ended up speeding up and hurting millions and millions of people in terms of healthcare. And those actions are starting to be felt this month. So actions like, closing hospitals, the number of people that are going to be affected by Medicaid, some of that will show up, or by the Medicaid changes, almost $1 trillion of cuts to Medicaid in order to pay for tax cuts for the rich. Some of those things will take a long time to show up, even though we've already seen rural hospitals close in America because of Medicaid payments drying up. But without urgent action right now, like this month, like these next 2 weeks, what we're seeing is that almost over 4 million people, 4.2 million Americans, will lose their health care, period, and another 20 million are facing major premium increases when the American Affordable Care Act, also known as Obamacare, when those tax credits run out. These millions of people are getting notices right now that their premiums are going to go up by 25 to 50 to 75%. So that's why the Dems basically said, wait a second, this is almost 25 million people in America. This is not small chunk change. This is a lot of people. You got to do something about it. And the Republicans said, no, we're not doing anything about it. We passed a law they passed a law in July that did this. And this is the first time that there's any leverage for the Democrats to basically say, stop this, don't hurt people. And that's what this is about. And, what we're trying to do as a national union is there has to be a choice between this kind of cruelty and a broken status quo. I mean, that we know, and we know that that's part of what elections are about in November 2025 and November 2026. But the Dems are trying with their funding bill. They're not looking for everything. They're looking to fix this. They're saying this is hurting Americans right now. Fix this right now. Come to the table and fix this. And they also know that if they don't make a stand about this, the R's are not going to fix anything because they passed the damn bill in July. They want to give tax cuts to the billionaires and they don't really care about regular people. So that's why I just want to, and that's why we're having Catherine and Shannon and Heather on, because they see it. They know what's going to happen or is happening already in terms of healthcare. And so I'm really, really grateful that we're doing this special podcast. So I want to start by asking each of you to talk about what it's like day to day, hour to hour for you right now. I mean, it's not the first time we've seen an attack on healthcare, but, give listeners a sense of what's going on in terms of, hospitals right now and, just what you're seeing. And so I'm going to start with Shannon and go to the Heather and then go to Catherine. And next time I'll turn it around. But I'll start with the person who is the farthest away from the continental U.S. in Alaska. Thank God for you, Shannon.
Thank you so much for having me. So I can't even begin to tell you what my day-to-day is like because it is so stressful. I work night shift, so I see people at their most vulnerable. I'm a mental health nurse, so I work both on the inpatient unit with adults and adolescents, and I work in the psychiatric emergency department, so where we're seeing our most critical patients. Every day, the numbers are increasing. Every day, more and more patients are coming in that are asking for medications because they have no insurance coverage. They have no Medicaid coverage. They're being denied.
Kind of, I don't mean to interrupt you. It's kind of like going back to the bad old days, or it may be even worse. Yeah,
exactly. And our emergency rooms are overflowing. The other night, we had 75 people in our waiting room. We were full. We're on what's called divert because we did not have enough beds in our hospital, in our emergency rooms. And the problem is it's going to get worse because we live in a state where it's getting very cold and very dark. And anyone who has mental health or has known about mental health issues, that is not a good situation. It's a recipe for disaster, basically. And unfortunately, it's becoming, we're working more hours. We're working more days. I worked 5 days this week, 5/12, and I'm exhausted. But I do it because I love what I do and I love my patients. And if I don't do it, who will step up? And that's where we're at. And that's not even touching our critical care hospitals in our rural areas. It's even worse for them. People in these villages have no access. And it's leading to a terrifying situation.
I think people don't understand, and I'm going to ask Heather and Catherine as well. And Catherine was in Washington last week speaking about this very publicly. So that's why I wanted to go to you last, Catherine. But Shannon, I think people people who live like in a place like New York, I think Ohio and Connecticut may be a little bit different. But if you live in New York City, you don't really understand that in rural Alaska, you can go miles without a rural hospital. And then if that hospital closes, there's no access. Can you just talk about that a little bit in terms of giving people who don't live in Alaska a sense of the urgency of this?
Sure can.
Giving my New York City colleagues a sense.
Yeah, I have to laugh because people don't, I think, realize how big a state we are. Texas can fit inside of Alaska 3 times. That's how big a state we are. Unfortunately, our population is not that big. We have less than 1 million people in our state, but access is, it takes, if you live, let's say you live in what we'd call Kotzebue, which is on the very right side of our state, it takes over 300 miles to get to a hospital. And on top of it, there's no...
Wait. Okay, podcast listeners,
Yes.
300 miles.
Yes. And that's not counting. You can't just hop on a road. You have to take a plane or a boat to get to someplace in Alaska. And it'll take up to 10 to 12 hours to get there. So when people talk about, oh, I'm going to run down the street. Well, for us, running down the street can mean a 9-hour, plane ride. It can mean getting on a boat and being on the open ocean for hours just to get basic medical care. And these are individuals who are our most vulnerable. These are our citizens and our community members who need it the most. Alaska has we're in the top 5% of states, actually in the top echelons, I should say, of the states with the highest suicide rate, with the highest domestic violence, with the highest incidence of gun violence. And, when you think about it, we have more trees than people. We have more polar bears than we do shopping malls. So the concept is we can't just go to the grocery store. We have to have groceries flown in some areas.
All right.
A gallon of milk right now in some places costs $15.
These are real issues for real people. And, people don't understand that you don't just go down to your block to CVS or to Dwayne Reed and just put in just walk in and get what you need 24/7.
No.
Thank you, Shannon. Thank you. Heather, what's it like right now? And you were on our podcast a few weeks ago talking about this big, ugly bill and about the concerns not only for your own family and for your father, who's a disabled vet, but what it means writ large. So now it's a few months later. Tell us what you're seeing. And thank you for being on a second time on this podcast.
Of course, always. I thank you so much for the invitation. Connecticut Hospital Association just put out a release that kind of talked about the fact that here in Connecticut, the chronic underinvestment in Medicaid compounded by the growing operating expenses in the state has left Connecticut hospitals struggling financially already. So that's before these 60% of the payments that are going to hospitals from the federal and state government are looking to be cut, decimated, right? So we're already at a point where we're struggling to staff, keep people in the state, keep people at the bedside, both, in all facets of healthcare, providers, nurses, techs, everyone struggling already. We had a year this year, which was a banner year, right, for the hospital. So I work in the surgical services area where we're recovering patients after they're having surgery, any type of surgery. And typically the summer is our slow season, right? Nobody wants to be in a cast in the summer. Nobody wants to be, on bed rest for 6 weeks during the summer. So it's typically our slow season. They had a record-breaking year, a banner year in the number of surgical cases that they've seen on a daily basis, which means that not only tells us how many emergency cases we're seeing an influx of, but also scheduled cases that we're seeing an increase of that people need treatment for, right? So this was our slow season, and we were already at max capacity. Our emergency room can typically hold somewhere around 30 to 40 patients, I'll say comfortably, but I'll use that term very softly. And on the average, we're actually seeing our emergency room having between 50 and 80 patients on a regular basis. People are sleeping on stretchers. People are sleeping on stretchers on our inpatient units, waiting for patients to get discharged first thing in the morning so that they can then siphon them into those rooms. It's a wild cash grab right now. And we're headed into what I think all healthcare workers are expecting to be one of the worst respiratory, cold, flu, COVID, all of the respiratory panel viruses that we swab for. We're going to get crushed in the fall and the winter this year. Absolutely decimated. When you compound the idea that we have someone who doesn't believe in vaccines leading our Health and Human Services Committee, right, who's telling people don't get them. And we already have a population that is getting more acute and chronically ill on the regular, we're just setting ourselves up for a recipe for disaster.
And in some ways, and you see this, I mean, again, I'm just taking my own experience. I just got a notice yesterday, like from CVS, I got my COVID shot, I got my flu shot. I took a picture of my arm when I got both of those shots, as I'm supposed to do. I had a unicorn sticker, by the way, when I did both of those shots, because I'm still afraid at 60, almost 68 years old, my shots. I want to see all of you laughing when I say that. But I have to go to my doctor to figure out whether I should get RSV. And yet CVS, who I've used forever, says, why have you not come in for your RSV shot? So your point, Heather, about what Kennedy is doing it's mass confusion. And how many doctors have basically said, we don't, look, we need to actually see patients who are sick. We can't get all these calls from everybody who says, what should we do? What should we do? And that's what Kennedy is doing to people. I mean, so if you have, concierge care like a Trump does or a Kennedy does, that's fine. You have a doctor on call. But what happens if you don't? What happens to people? It's mass confusion right now about whether people should get shots or not get shots, and look at what's happening with measles outbreaks and look what's happening with other things. And that just puts more pressure on what I'm hearing you say, Heather, is that just puts more pressure on you and puts more pressure on an emergency room. And then the knock-on effects of if people don't get vaccines for COVID or RSV or flu, what happens if somebody gets RSV? You think about what that means in terms of the amount of care that person needs. So thank you for putting all of this stuff together. I really appreciate it.
And then it's important to remember, too, that they're also yanking all of the telehealth and at-home services, right?
Why don't you talk about that a little bit, about how crazy that is?
So,
I thought that these people like telehealth. Why would they cut all of telehealth?
Well, pre-pandemic, you never really saw telehealth, right? Maybe an isolated incident of it here and there, specialty provider that could actually perform a telehealth visit in an appropriate manner, you would see it. But telehealth became really the new norm during the pandemic and post-pandemic, right? So you can see your primary care provider, your mental health provider. I see my endocrine doctor on telehealth visits to make sure that my thyroid is working appropriately. She sends over the rec for me to get my labs done. I go get my labs drawn, then check back in with her, and they change my prescription around, right? It's completely reconfigured how people can access healthcare in urban and rural areas where they maybe can't get in a car and drive to a doctor's office, or get on a bus and get to a doctor's office, or don't have a ride. So the fact that one of the big things, and last time I really kind of talked about Planned Parenthood and that being gutted is such a detriment, but now looking at telehealth and all of the services that are being yanked and just completely shut down, and the suicide crisis line, you're ripping away the ability for people to get basic mental health, preventative care, and regular continued treatment for chronic health conditions in the comfort of their homes, where it is cheaper and more accessible. Then you're just eliminating that possibility for millions and millions of people. And it's a complete and total atrocity.
Yeah. And these stories, this is kind of why we wanted to do this special podcast now. And we'll get it out early this week, but we are taping it on Saturday for everybody who is wondering. These ladies who you just heard from Shannon, who worked 5 days, 5/12, are taping this podcast on Saturday because we are trying to get the message out of the urgency of what is being fought for right now. The Dems, and many of you know that I left the DNC, but, the Dems are really trying to actually say, let us help workers. Don't do mass layoffs. The unions have also filed a suit about that. Don't hurt people more, hurt people less. And that's what the Dems are trying to do. Let's get back to at least the baseline of what we had, in June, instead of making it worse. Now, Catherine, you actually came to DC. I teased about this earlier because I saw all of the selfies that Congress people, not just Congress people in Ohio, took with you after you spoke. So talk a little bit about both what you're seeing now and, frankly, what compels you to go to DC to talk this week about, or last week, about why these, Obamacare tax credits and why trying to deal with 25 million people either being off healthcare or having premium payments that are going to be so high that they won't be able to afford it. Tell us a little bit about both these things, why you came to DC and what you're seeing.
I'll start with what I'm seeing, and I will echo the sentiments of Shannon and Heather. Everywhere is crazy right now. What we're seeing as far as our surgeries, we are having more people come in to get their surgeries done. I am sure that people are trying to move up their appointments to get their surgeries done and completed before, the worry and wonder of if I have health care is going to hit. And then as far as our emergency rooms, we're seeing...
Catherine, let me just remind everybody who's listening, if you weren't here at the beginning of the podcast, Catherine is an oncology nurse. So when she's talking about surgery, she's talking about cancer surgeries. Sorry, Catherine.
Oh, that's okay. Thank you for adding that in. As far as our emergency rooms, we are seeing a lot of times where there are way too many patients. Patients are in the hallways on stretchers. There are longer wait times to get beds upstairs on inpatient floors. So there's an increase in workplace violence. And, the staffing crisis is still very real. So everything that everyone else is seeing across the country, we are seeing in Ohio for sure. And in relation to the cuts, as far as Ohio is concerned, we have a potential for 11 of our rural hospitals to close, which obviously would place more burden on the urban areas to provide care where, it's already stretched to bare bones as is. So these cuts, affect everybody. And as far as cancer treatment, obviously we know, like preventative measures. If people don't have insurance, like, a colonoscopy or a mammogram, that could be detrimental. That could be someone's life because they don't have access to be able to get that done. And now switching over to...
if you don't get, for people who are listening, if you don't get the colonoscopy that you need every X number of years, I think it's still 5 years or so for most of us, or if you don't get the mammogram every year and all of a sudden there's cancer, that's a life sentence if people can't see it. Is that what you're saying, Catherine?
Absolutely. It is absolutely a life sentence. And on my floor, those are the patient populations that we routinely see. Breast, rectal cancer, liver, hepatobiliary. I mean, you name it, we see it. So in addition to people just being in the central Ohio region, we have people coming from all over the country to access cancer care in Ohio. So that's putting a huge burden on the healthcare system overall across the country with people not having access.
And then what happens is if you're in stage 4 cancer because somebody hasn't detected it beforehand, then the cost of treatment is so much more, right?
Yes.
Yes. And then so then you got a situation of the costs are, who can pay for it? Who can afford it?
Absolutely.
And then the state pays for it. Then the state ends up paying for it, or the hospital absorbs it because what's happening in terms of Medicaid and what's happening in terms of Medicare. And, nobody's going to we're still in a country where nobody's going to kick somebody out. Still, don't know how long, but nobody's going to kick somebody out because, their treatments are so expensive.
Correct. And I feel like the other possibility is that people just won't get care at all because people will be under the impression like, oh, I know I can't afford this. I'm not going to go. And where does that leave the general public? And how do we move forward from this? Like, this will be an absolute catastrophe for healthcare.
Yeah. Yeah. And so we have over 250,000 healthcare professionals that are a part of our union. And Catherine, we talked to you and you volunteered to come to DC. What compelled you to speak out publicly? I mean, I am really, 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 really grateful for it. I want to make sure you know that. But what compelled you?
Well, when I got the call, it was a couple days before the event. And it was just like, wow, I have an incredible opportunity that someone thought enough of me to be able to go and speak for nursing and to speak for our patients and to speak for our communities. I mean, they absolutely need to hear that because I think that there is just not a reality check with what's happening at DC with the Republicans and the general public. There is so much of a disconnect about how people are struggling every single day versus how they are just making these arbitrary decisions without really focusing on the public. Like, this is what you were elected to do, to be a public servant, and it doesn't seem like that's what's happening right now at all.
So I'm going to ask all of you just the last, because again, this was a special one. We interrupted your Saturdays. So I want to ask everybody just this one last question, which is, if there's one message we could send directly to President Trump and Congress, what would it be? And I'm going to start with Heather this time and then go to Shannon. And since I just did so, and then end with Catherine, who's already given a public message. But if there's one message we can send to the president and we can send to the Congress, what would it be?
So I apologize because I'm going to overstep because I am going to bring this back to my dad because that
is not an overstep at all, Heather. I am glad that you are doing it.
Because in doing my due diligence by my father, right? So in 1944, right, the Veterans Preference Act was passed, right? So it gave veterans a hiring leverage, right, over someone who is not a veteran, right? And the cuts that are coming down the pike to the federal level is going to disproportionately affect veterans, okay? 30% of federal workers right now are veterans, and half of those are disabled, right? So that means that our veterans, who make up 6% of the U.S. population, are currently being disproportionately affected by these federal workers' cuts. So that is just something very important that I think it's really important for people to understand, as well as the fact that the Office of the Inspector General's 2024 report on VA staffing shortages revealed then, a year ago, right, that 137 of the 139 VA health centers nationwide reported a severe staffing shortage in at least one area, particularly nursing and psychology. Two of the areas that our veterans need the most support in, right, when they are dealing with post-traumatic stress disorder or any other litany of physical or mental issues, right? So again, when we're thinking about who the federal cuts are affecting, this is a very important portion of our population who really need to be remembered in all of this. And it's not just a rich, a poor, a African American, a Hispanic, a Caucasian issue. This is everyone across the board is being assaulted with these cuts.
And I think it's important, if I may, to say that, look, every government has preferences about who they help and who they don't help. But what Heather is saying to all of us is that the people in America who served in the American military, who protected us, who have had a preference for federal employment, particularly if they are disabled, and so many of the people who went to war on America's behalf come back disabled. Mm-hmm. That this government, the Trump administration, is abdicating its responsibility to the people who served us, including her father. And that this is actually one of the first times that instead of just benign neglect, there is actually malfeasance. There's actually a taking away of rights and of benefits that disabled veterans have gotten. And that's what I think you're saying. And thank you very much for saying it.
It's a sad day in America when we're watching men and women who are more concerned with maintaining their kung fu grip on their billions and their power than they are about doing right by the American people, right? In 1984, the Statue of Liberty was designated an UNESCO World Heritage Site, right? And UNESCO is the special division of the UN that promotes world peace and security through international cooperation. Their statement of significance describes the statue as a masterpiece of the human spirit that endures as a highly potent symbol inspiring contemplation, debate, and protest of ideals such as liberty, peace, human rights, abolition of slavery, democracy, and opportunity. Sadly, today is a day where I question whether we even deserve that designation anymore because of this current administration.
Heather, you just gave me chills, and you just gave me a really good lesson for my social studies class, because that was said as great as any civics teacher I've ever heard. So thank you. Shannon.
It's sometimes hard for me to talk about these issues because we're in the middle of it. I take care of patients every day who are terrified, who are fighting demons we don't understand and don't face. And so I hold their hand and I talk to them in the middle of the night and make sure it's okay so that they can close their eyes for an hour to get a little bit of sleep and a little bit of peace. And what I would ask our president is, what if that was your family member? What if that was your son who's fighting demons we don't understand, who doesn't even want to be a part of our world anymore? And how do we fix that? How do we change that? How do we make it so that it's worth living in again? And so I'd ask them, take a walk in my shoes for just an hour. Be with people who are fighting things we can never understand. It goes beyond healthcare. It goes beyond politics. It goes to the human spirit, and it goes to dignity. And it goes to realizing that we're all we have. We have each other. And if we don't start embracing that, then we're on a precipice. We are tipping the scales to, losing just our human spirit and our ability to be kind and our ability to have, respect for one another, but also love for one another, because the world is a cruel and scary place sometimes. And if I can bring just 1 ounce, like 1 hour of peace for someone, then this is why I'm here on this earth. This is my job. This is why I do what I do. So
God bless you, Sharon, and thank you. Thank you. And Catherine, we're going to end with you in terms of what is that message that you send directly to President Trump and the Congress? I know you have already, but in the last few days, what's that message?
I would like to say to them, much along the lines of what Shannon said, people deserve dignity. Dignity is healthcare. Dignity is respect. Dignity is about being able to just afford to live and exist. And until they understand truly what that means, I don't know that we will be aligned. And it's really unfortunate. It is really heartbreaking for people that have put their all into their careers, whether it's a federal worker or for us as nurses across this country, providers, because we are seeing firsthand just how the system is breaking down and how we are trying to hold it up on our backs. And there's only so much more strength that we have. We need people to come together now more than ever and support each other, support healthcare, and support being a decent human. That's what I would say.
Thank you, Catherine. For those who are listening, particularly for Congress or the president who's listening, particularly for the leader of the Senate, Mr. Thune, or the leader of the House of Representatives, Mr. Johnson, or the President of the United States, Mr. Trump, and all the people around you. You've just heard from 3 frontline healthcare providers who every single day are seeing people in America, whether it's from Ohio or Alaska or Connecticut, and I'm sure if you listened, you'd hear it everywhere else. They are seeing families. They are seeing people break apart. They are seeing human suffering. They want you not to be, you Congress people, don't be disconnected about their struggles, about human being struggles. Don't just, as Heather said, look at the Statue of Liberty and not act in the way that that poem is about. Do something to help people, not just to help billionaires or trillionaires. Do something. And that is what we are saying. Reject the binary. Open the government. Do the work that we need to do to deal with at least the Obamacare credits and the hospital closures and this $1 trillion of Medicaid losses that is now making things worse. Do something right now. People deserve, I'm just repeating what you 3 ladies said, people deserve dignity. They deserve respect. These 3 healthcare workers are doing that every single day, as are hundreds of thousands of our members. We deserve better from our Congress. Republicans, work with the Democrats. Deal with the issues that the Democrats have raised instead of shutting the government down, and do it now. That's what I'm hearing from Catherine Henderson, from Shannon Davenport, and from Heather Brauth. Do something right now. Thank you so much, ladies, for helping us with this and helping to make this real. And for anybody who's watching, if you feel moved, visit AFT.org, send a message to Congress. And thank you, everyone, for listening to another episode of Union Talk.
I hope you enjoyed this episode of Union Talk. Remember to subscribe wherever you listen to your podcast and tune in every other week for a new episode. Thank you, be safe, and be well.